That's good.
That's wonderful.
I could go the other way on you.
You've done that before.
Yes, I have. Is that good?
Yeah, it's great.
All right, we're still fixing our headsets in the studio.
I can't hear anything.
What? Turn on your mic. You'll hear. You can't hear anything. Great. We're digressing, and it's only 21 minutes into the show. Jeez Louise. Well, the nice thing is we'll get right back on track here because our guests are in studio. Compassion Care Hospice, our great supporters, and we want to thank Lori and crew for supporting Vegas Unwrapped and working with us the last X number of months. And sitting here was actually sitting next to Mr. Cash. To his right is Nicole. I don't remember what your full title is, but I may be promoting you right now. Director of Marketing.
I'm actually the lead community liaison.
I like Director of Marketing better. And it was actually Nicole who we met almost a year ago at the Senior Spotlight Spectacular. It was one of our folks that were helping us that day. Introduced herself to Nicole, and the rest is history. So it's good to see you again.
You too. I can't believe it really has almost been a year.
I believe, March or April, the first event? Yeah, absolutely. And of course, we saw you at the last one
with
the Orleans. You were tucked in that little corner spot there. And joining us this time, Lori decided to pass on the baton. To actually have us tonight give a little different perspective is Samantha, but I heard you introduce yourself as Sam. Which do you prefer?
I usually go by Sam, but with our population, if I say Sam, I get in trouble because that's a boy's name.
Oh. Okay.
So either or.
Either or. She is an RN for Compassion Care, but she's basically your head of admissions.
Yes.
So we're going to spend a little time talking about what happens when someone chooses to go into hospice care and what the processes and procedures are, Mr. Cash.
Sounds like a good idea because, once again, this is an area where most people are totally clueless.
Absolutely.
So we're glad you're here. Tell us about the process.
So typically, if you're at home, either you have a loved one at home with you or in a facility, and you're not sure if they're hospice appropriate, you would give us a call, kind of let us know what's going on, and we would send a nurse out to evaluate.
Okay.
That nurse is educated and has done lots of training to see exactly what would make them appropriate.
Now, what are they looking for when they go out and make that first evaluation?
Things like weight loss, any sores that may have happened, any decline, basically, over the last 6 months.
Okay.
Just to see the person they are today, if that's any different than they were 6 months ago. Sometimes the patient's not appropriate, and that's okay too. We'll at least give you a heads up on what to look for. And if they are, then we'll help you in steering in the hospice direction also.
Okay.
You know, when you see people 6 months after you've seen them and they've lost 35, 40 pounds, it is a scary sight.
Yes.
How do you reassure them just on that first visit that even though this is what you see, we're going to work with you, and how do you ease the mind, not just of the person who has had the weight loss, but of the caregiver who's called to ask for your help?
Kind of let them know that we're here to help them. Especially if they're at home, that's when it's a lot more difficult, because that's when they're nervous about the changes that they're seeing, whether their loved one is no longer getting up every morning or no longer being able to go to the grocery store or even use the bathroom on their own. Unfortunately, it's part of the process. But we would make sure that we would be there to help them, with caregivers, volunteers, nurses to come to the home. They're not alone in this journey anymore once you elect hospice. You have a whole team that's on your side to make the transition a lot easier for you.
I would think that that's obviously the best approach to take, because I think the support in numbers is sometimes a whole lot better than just one person saying, "Don't worry, everything's going to be okay."
Right.
Absolutely.
And I want to clarify that Compassion Care Hospice provides in-home service,
right,
versus other hospice providers where you have options of either doing in-home or what would you call it, in-center, I guess? Inpatient. Thank you. So I just want to clarify that you're more of the mobile in-home service.
Correct. Well, and that's the nice thing with Compassion Care and having an admissions team is it can be very overwhelming and scary for not only the patient that needs to get on service, but like you said, for caregivers, if it's a spouse, it can be a very scary situation. And having a nurse be kind of the first point of contact to come in, answer their questions, kind kind of ease their fears. And then from then on, we're available to families 24/7. So they can call us anytime, day or night, and we're there just to support them, which is huge.
Do you visit and go out on these first admissions at all to see not just to see the process, but does it help you in being able to then, when you promote and go out and talk to people about the service, do you go out on these first calls at times?
Absolutely, yeah. It's a nice kind of team effort. Marketing and admissions work together. So if all admissions are busy, then the marketing is going out, and they're the first point of contact with the family. So, like Samantha said, we're all educated, and we know, what we can offer and what we need to do for these families. So we work together. It's really nice.
How much I meant to ask you this last time, but
the fact that you even remember the question from last time
is incredible.
And remember it today.
How much contact do you have with when I say their, meaning your clients, with their medical practitioners, their doctors?
In the beginning, we would call them. First, we talk to the family to see if they want to keep their current doctor or if they want to switch over to one of our doctors. The difference being, if you switch over to one of our doctors, we can get a hold of them 24 hours a day. If anything happens, if we need to change medications, anything like that. If they want to continue on with their private care physician, then we would give them a call, let the doctor know, and kind of go over what medications they want to continue or anything they want to, anything they want to stop right up front. And then we're in contact with them every week thereafter. Either it's an update or to get a new order, or just see if they have any questions about the care.
It's good because it's important to have that consistency in medical care, but I didn't know the other part about you guys having your own, physicians that you work with as well. It's great. They really have the whole package.
Yeah. A lot of people also kind of think that if you sign up with hospice, you lose the decision making and we take over and we tell you what to do. That's not the case. We're there for you. So we're basically supporting you in your decisions and whatever you want to do from that point on. We're just there to support and help. So it's your decision and we're there. If you want to stick with your own physician, you can do that.
What's the nurse to patient ratio? In other words, how many patients is one nurse responsible for when they go out and make their visits? You have a teacher to student ratio? What's the ratio per nurse per client?
I want to say on average it's 10 to 12.
Okay.
And of course that could change depending on what our census is and who's being taught and educated and things like that. But that nurse sits and makes their schedule at the beginning of the week to see all of those patients. When that nurse is there, they're there for that patient. That's usually an hour to 2 hours when they're there.
Okay.
But like I said, it's usually 10 to 12 during the week. And then, of course, there's the on-call.
Okay.
Who are still there after hours.
Is that a good average? Is that high? Is that low versus national averages? Or is that about on par for hospice service, a 1 to 10 or 1 to 12 ratio?
I want to say, I think it's a little bit below. I know some of the larger hospices here see like 15, I want to say even like
17.
20 patients.
Wow.
That's high.
Yeah.
Because I'm thinking if you do a 10 to 12, let's say,
right,
and maybe a 2 to 4, 5 days a week, that's 10.
Right.
So and then you get a couple more in there. I think that's pretty good because if you have somebody coming in once a week for 2 hours, that person's going to feel like,
Of course.
really good about that.
Well, and from a marketing standpoint, meeting families and getting to know their needs, it's nice to watch them be assigned a nurse and a CNA, and that those two people stay the same throughout the time that they're on our service. So we're not switching between different nurses and different certified nursing aides. It's the two same people coming into the home on a regular basis. So that continuity of care is really important to us, and our nurses really get to know the families and the patients.
Do you have a staffing issue at all as far as turnover and replacing people and hiring new people? I don't mean that as a bad thing. I'm just saying, is that something that's ongoing with you?
To be honest, I've been with Compassion Care for 3 years, and what I see, people that leave, it's because they leave Las Vegas. They move out of state for whatever reason. It's not, to go to another organization or to do something different. It's just because they're leaving. So
that's high marks.
Yeah.
Besides, If you thought about leaving, Lori would scare me. And I mean that with all due respect. No, I'm only kidding. All right, we're going to step aside for a quick break. When we come back, we're going to get into more about what the process is after that initial meeting with the potential client, and put everybody's mind at ease, because it could be scary. Hospice is could be a scary situation for those who don't know. You're listening to Vegas Unwrapped. Aaron Phillips, Ricky Cash, everybody in their normal positions. You're listening to Nicole and Samantha from Compassion Care Hospice. More with them right after this. Just done. Guess what I just done, dude?
Yeah.
Dude, done. That sounds like something, what's his name? Brian Hoffman would say as Red Skelton.
Yeah.
I done doed it.
I done doed it.
I done doed it. All right, welcome back to Vegas Unwrapped. We digress once again, as always, and it's early tonight for digression. Jeez. Usually the second hour is really going to be interesting with who knows? Well, I almost ruined the surprise, but I have a surprise call for you coming in the second hour.
I'm always up for surprises.
I know you are. All right. Just where am I going? I have no idea. Maybe if I follow the production sheet I make up, that would help. Joining us at the microphone is Nicole and Sam from Compassion Care Hospice. And we're talking about what the procedure is and some of the things that happen through admissions when there's a potential patient, client. Do you guys call them patients or clients or friends? What do you call somebody who's on the service?
I like to call them clients.
Okay.
Coming from nursing standpoint, they're patients.
Okay. Because,
It makes sense.
But it sounds harsh.
Well,
but the marketing side is clients.
And certainly if you're in a hospital,
that's right.
You're a patient.
That's right.
No, you really do. I can call some patients friends. You really make connections with some people.
Right.
It's a good thing.
Oh, absolutely.
Yeah.
And they appreciate it too. Mm-hmm. And I'm sure they do. All right, so let's go back to the beginning. So Sam, you go out, you do your evaluation, you determine yes, no, whatever. Let's presume that there's a yes. Mm-hmm. What happens next in the process for someone to get onto the service?
We would discuss kind of how we talked about before with the physician, if the physician wanted to remain their current physician. If they did, we would see if that doctor wanted to change anything. If they didn't, then we would contact one of our physicians to take over care. And then that's when a lot of conversation comes in with the family and the patient involved to see what they need done first in terms of medications, in terms of any equipment that they need, in terms of any questions that need to be answered. So
what's your most usual questions that they ask?
A lot of it is the medications.
Really?
A lot of patients that are appropriate are on a very long list of medications that they do not need half of them.
That they don't need half of them?
That they do not need them at all.
Wow.
So obviously things like vitals will be done, a head-to-toe assessment, and that helps narrow down what medications are necessary. And then, of course, like I said, we'd include the family in on all of this. So they're involved. We're not going to stop a medication if the family is not comfortable in stopping it. But, of course, we're going to educate on why we'd want to stop that med.
And then ultimately it's still the choice of the family or the client to say yes or no.
Right.
Okay, gotcha.
And it's not just, we're not just there for the patient, it's the entire family.
Right.
So if your loved one has a bit of a memory loss, it's going to have to be your word standing up for them, and we're going to listen. Gotcha.
Okay. So now we've gone through the case file, basically, and we've got everything in order. Then what? What happens next at that point, once everything's approved and in line?
Then we would do things like order the medications, or like I mentioned about the equipment, if you need a hospital bed, if you need a wheelchair, all of that is covered by hospice, and it gets delivered typically the same day, unless you want it the day after.
Okay.
Our visit's usually about 3 hours. We have the longer visit because we're going over your complete health history.
Which makes sense.
So everything, any documentation that you have, any illness that you've had that you want us to know about, we're going to make copies and we're going to document that in our system. After the admission nurses leave, that's when you're going to meet the next day your team. Your RN that's going to be visiting you every week, and they're going to set you up with your CNA, your social worker.
And these people all come to the client's home to do all
Right.
of that? Okay.
They contact you usually between 8 and 10 in the morning to set up a time to come out there, and that's when you start your relationship with them and know what days work best for you and what exactly needs to be done between your team to make the entire process easy and comfortable.
Who determines, and I'm sure it's you guys, but I'm just more for the listenership, who determines how often you're out there to see them? In other words, once the plan is in place, Who determines how many days a week, how many hours? How does that come about?
It's the patient and the family. It's our guidelines that we have. The registered nurse has to be out there once a week. And then more than that, if something happens, if a fall happens, if you have a medication question or anything at home that you may need assistance with, is another sign for the nurse to come out. In terms of the CNA care, they can come up to 7 times a week, and that's up to the family and the patient. If you want a bath 7 times a week, you can have that. If you want to get up out of bed and dressed only 3 times a week, that's totally fine and up to you. You're kind of the maker of the rules in that case.
Do you get volunteer caregivers?
You can have volunteers. We ask that you give us a little bit of a heads up, about 24 to 48 hours. Say your loved ones want to go to the grocery store and don't want the patient home by themselves. Let us know. We can have a volunteer come and sit with them and stay with them.
Do volunteers can they go just to visit a patient, to keep them company, play cards with them or whatever on their own
Yes.
schedule? Is there a schedule for that?
It's based on the volunteers' availability.
Okay.
Again, because they're volunteering, it's, however many hours they want to donate
Sure.
their time, what they want to do. But just to clarify, volunteers cannot do any sort of care.
Of course.
So yeah, it'd be more for companionship. Like Samantha said, if somebody has to run errands, or if like the spouse or the caregiver has their own doctor's appointments and things like that, and we just need someone to sit with our patients, then that's the type of thing that we would do.
And we do have special volunteers. Volunteers who are certified with pet therapy, with aromatherapy oils, with music. We have volunteers who play instruments. So whatever the family and the patient desires, we'll make sure we get that volunteer in place.
Gotcha.
So you have a wide range of assets to call upon to meet the needs of every single different type of person that needs your care.
Yes.
Absolutely.
That's a huge undertaking as far as making sure you have all of that. That's, even let's say, just for argument's sake, you have 50 patients. You might need to have 300, 400 people available to cover all those patients. Wow. That's huge.
Why,
Lots of backup.
you thinking of a new line of work now?
No. I'm just so impressed with the fact that this type of care is available to the less fortunate and those who are, ill and infirmed. I think it's amazing the type of job that's being done, and I'm glad we're helping promote it, because I don't think enough people know about this.
They don't.
And this is all being paid through Medicare and Medicaid and all that, all the insurance companies.
Absolutely,
right?
yeah. Everything is covered 100%. Like Samantha mentioned, especially with the admissions process, we set up delivery of equipment. The medications are delivered to your home, so you're not having to pick them up from a pharmacy. We go through a company that we contract with, and they deliver to the home. So all that's taken care of, again, to make it easier on the caregivers.
Absolutely. It's like going to RC Willey for furniture. Schedule it and they deliver it.
It's amazing.
So from beginning to end, from the time that you make your first visit, your consult, your evaluation, to the time someone starts service, what's the average length of time from beginning to end? Is it a week? Is it 3 days, 2 days?
Oh, no.
One
It's
day?
that day.
It's hours.
It's that day.
The admission nurse is the one that starts the service.
Okay. Oh, gotcha.
So we're
okay.
considered the first visit.
Gotcha. So by the next day, worst case scenario, the nurse may make their first visit, or the CNA or whatever, and start. Okay.
Equipment arriving, things
Yeah,
like
absolutely.
that. That's great.
That's amazing.
What kind of equipment? Let's just touch on that a minute. Wheelchairs, canes, walkers, beds, what
Mattresses.
Oxygen, nebulizers, floor mats if the patient's falling a lot, Hoyer lift if the patient's heavier and the family can't lift them out of bed. Anything that we see and that the family agrees upon would be necessary in keeping that patient home and comfortable.
Wow. What if they live? What if all their needs are on a second floor?
Set up the room downstairs.
Really?
We get a lot of the times where the family, if they have a living room downstairs or a family room.
Thing,
Right.
It happens a lot. We'll put as long as there's room in the family room or in the living room or even the
Set up shop
kitchen.
downstairs.
Set up shop down there.
Yep, you bring the hospital bed, the oxygen, an overbed table, everything that they need right there.
We used to do that when my grandparents, rest in peace, when my grandfather was sick.
Sure.
Came home from his angina attack. They set up the dining room. They moved the table, and in came the bed, and in came right there in the dining, because he couldn't climb steps.
Right.
You can't climb steps. What are you going to do? You know.
Right.
So, all right, guys. Unfortunately, that kind of wraps it up already.
Already. Wow.
Next month we'll pick up
Goes
another
fast.
topic. Wasn't it? Always goes
Very
fast.
fast.
Give website, contact information,
All that good stuff.
all the good stuff.
Yes, our website is cchlv.com. Any information you may need is on there. Our office number is 702-636-0200. If you have any questions about hospice, you can ask for myself. Again, my name is Nicole, or for the admissions department, and we will help you get your questions answered. Also, please remember, anyone can refer to hospice. If you have a loved one, a friend, a neighbor that you think may need our help, please call and we can come out and do a free assessment.
And it doesn't mean, again, that they're on their last days. It could be weeks. Any kind of decline that you notice. They're not eating, they're not outside as much, they're not talking as much, they're not driving anywhere anymore, they're losing weight, whatever signs you see that they were not showing to you a couple weeks ago, don't be afraid to call. The worst we can tell you is they're not appropriate and set you up with another service.
I just want to know on behalf of Mr. Cash, can we just sign up for the bath service?
You need a CNA.
I'm telling you.
Preferably a female.
Now I like it. Now it's good.
Love it. All right, guys. Thanks for coming in. We'll see you next month.
Yes.
We'll arrange with Lori what the next topic will be. It's always good to see you guys. Nice to meet you. Connect with us on Facebook so we can get the links up.
Definitely.
If you've missed anything in tonight's information, tomorrow afternoon on our Facebook page on Vegas Unwrapped Internet Radio, we'll have the links to their interview with us so that you'll be able to pull it out and get some information.